Greetings, this is the coronavirus COVID-19 update for 3/21/2020. The Chinese virus. Whatever China says, it's a Chinese virus. So we start with Baidu, as every morning. Baidu is a Chinese search engine. And the big number here on the bottom left, cumulative diagnosis, 81,498. Up 82 from the day before, and this number is bigger than it has been lately, 82, because they've included Taiwan and Hong Kong in the numbers. Overseas input is a new number that started a couple days ago. 45 cases came from overseas. There's no detail on that as to where they came from. Cumulative death, 3267, and cumulative cure, which most people call recovery because most people just recover, up 506 from yesterday. And then if you scroll down on the same Baidu page, you will see a map of China, and the old traditional map is on the upper right, which showed the total number of cases, and now what they're doing is taking away deaths and recoveries, and each province has a new number then, which is much lower, and a lot of the provinces are lighter colored or even white. And this is graph number 1, replacing the old graph number 1 on the upper right, where they show total diagnosis, 82 new cases, and 45 come from overseas. The second graph compares domestic cases, new domestic cases against foreign, and you can see there's a pretty big difference here. 82 cases in China, 31,884 new cases in the rest of the world. And then this map I don't use, it's not very accurate. And then we have a list of provinces, which I used to open under Hubei to take a look at Wuhan and other cities. And now the bigger numbers are in like Guangdong, which Guangdong is the most populated province in China with 2 super cities, Guangzhou and Shenzhen. Beijing with 13, Shanghai 14, Hong Kong 17, Taiwan 18. So that's where you get your new numbers. There's kind of a little bit of a spike in Beijing and Shanghai and some other provinces, Guangdong, where usually there would be 1 or 2 cases. Then if you scroll down further, you see the hot search topics of the day and hot stories, and we're going to take a look at 5 of these today. So the first one on the left is mentioned that quarantine stations should be closed, and also roadblocks should be closed as they deem necessary. That would be all over China, basically. And on the right is a Chinese actor who returned to China after taking off to Australia when things looked bad in China, and now things are looking bad in Australia, so he's coming back to China. So I don't know, somebody said some isolation, to accept isolation lawyers, he said he couldn't work for 2 more years. I don't know, it's kind of a crazy story. That's his punishment for leaving China, I guess. And then the story on the left is some kind of a performance done by a woman wearing a mask, and she just said she just doesn't feel good wearing a mask. Some of China is still, under a lockdown, and this says Michigan, which is a city. That's the old cave-dwelling city in China. But I don't know if this is Michigan. Maybe some kind of contest. And on the right, this is a guy nurse who. After seeing all the medical teams from Sichuan province completing the mission and leaving. A couple days ago, the first batch of Chinese medical people left Wuhan, and That was Tianjin, the city with the big chemical explosion a couple years ago. That that team left and went back to Tianjin from Wuhan. So a lot of Chinese cities sent extra people to Wuhan, medical people, because their own medical staff wasn't overwhelmed. And this is Sichuan leaving now, and this male nurse was crying, and he wiped his tears with a swab. So it made the news. I guess if you want to get on the news, that's a good way to do it. Then we go to the coronavirus global tracker made by Johns Hopkins University and the Center for Science and Engineering, Center for System Science and Engineering, which is a research institute at Johns Hopkins, showing a total global number of 304,000, total deaths approaching 13,000, recovered, 91,000. And we'll take a look at some of these hotspots in the rest of the world. So the big news here is Italy again. Italy's really been making news here. 4,000 deaths yesterday, 4,825 today. So that's crazy. That's almost up 800. The last 3 days, Italy has set a new record for the number of deaths, but this is like 100 more than yesterday, or a couple hundred. So I was taking a look at the three big epicenters outside of China, which was Italy, Iran, and South Korea. Now there's a bunch of countries that are epicenters. But still, I want to focus on South Korea. That is the model country. If you look at this is an old news clip here. South Korea's coronavirus climbs above 7,000, most traced to a church. So this was a, Christian church with a, it's a crazy, sect is what it is. And, the church was in Wuhan recruiting people in December. And that's why this big outbreak happened, because people who returned from the church infected everybody. And we're talking about a church that has 1,000 churches in 1,000 locations, I guess you would say, in South Korea, and over 450,000 members. So one of the big churches in Daegu, which is a city in the southeastern part of South Korea, was the epicenter, and still is the epicenter. And it started, cases went from 0 to 7,000 because of the size of this church and because everybody gathering in a confined space. So if you take a look at this map, this graph here, which is mine, you can see South Korea in the orange was way ahead of everybody else. Up over 4,000 cases, 5,000, 6,000. And this is what it was looking like, back in early March. It looked like it was on an astronomical climb here, and it was going to kill everybody in South Korea. But that didn't happen. Because why? Because South Korea is the model country. So why is Korea the model country? Well, up on the upper left, you can see China and South Korea models seem to be the only way to contain the virus. China got it contained, but China made a lot of really big mistakes, like sending in medical people from the army that without good protection, and a lot of them died, thousands. Then South Korea wants to show the rest of the world how to tackle it. How do you tackle it? Well, you make test kits by the zillions. How do you make test kits? The WHO went to China almost immediately, and they published a paper that said, with the DNA from the new virus, and they said these are the genetic markers here that differentiate this new coronavirus from previous coronaviruses like SARS, And they said, you make a test kit that looks for these markers, and you have a test kit. If the test kit, if it turns positive, then that person has the new coronavirus. And they made these test kits by the zillions. They also invented this concept of testing people. They're testing 15,000 people a day, but it's not just hospitals that are testing people and tents outside of hospitals. They're walking around and getting people driving by. They're taking swabs and scan their driver's license, and okay, you're tested. It's just pretty good idea. Now the rest of the world's doing that now. They also sprayed down the entire country with disinfectant, and when they put people in quarantine, they give them these quarantine kits, which is food, water, and masks. And you can see there's also toothbrushes in there. So they just did everything right. And one of the best things they did was they discovered this drug, which it's beyond me why the rest of the world is not just using this drug. This is a drug called Coletra. It's made by AbbVie Labs. AbbVie Labs is a spinoff of Abbott Laboratories, which is one of the biggest pharmaceutical firms on earth. It's American. So Coletra contains two other drugs, lopinavir and ritonavir. So one's a malaria drug and one's a HIV drug. And the reason that AbbVie Labs is making Coletra is to fight coronavirus. Well, it's not approved by the FDA, but lopinavir and ritonavir are both approved. But the Coletra has not been approved to use with coronavirus. But, it's beyond me why the rest of the world isn't just using this drug. Because if you look at South Korea's death rates, they have under 100 death rates with 8,000 infections. News coming out of South Korea today, the Prime Minister urges religious, entertainment, and indoor sports facilities to shut down for 15 days. This is another thing in South Korea. There's no lockdowns in South Korea. Only Daegu, the epicenter, the city in southeastern South Korea. That's the only city that's shut down. Nothing else is shut down. Now the Prime Minister is saying, maybe we ought to shut down religious gatherings, entertainment, and sports facilities for 15 days. So they basically stopped this virus from spreading, by implementing everything else and not shutting down the country. That should be a model for every other country. So let's take a look at Italy first. Like I said, these numbers are pretty shocking. If you look at the upper right, 4,032 cases to 4,825. So almost an 800 increase from the day before. And the smaller pictures, when I think it's a good story, these smaller pictures are news from yesterday. So the big news coming out actually a couple days ago was that big truck caravan that came into a city in northern Italy, Lombardy province. And these army trucks came in by the zillions to pick up dead bodies in body bags because there wasn't enough room in the cemeteries in the city to bury them anymore. So the army trucks came in, loaded up full of body bags, and took them out of the city to burn. And one person said that this picture is one of the most sad pictures in the history of my country, and it's even worse today. That was 3 days ago. So for the last 3 days, Italy set a new world record on the number of deaths in one day. So from yesterday, then 627 died, which is more than the day before when that picture of the trucks popped up. And today, 793 deaths in the middle here. We close all production activities not strictly necessary. Some transport food and, are remaining open. Tobacconists, maybe, I don't know what, Italy must have a large part of the population that smokes. Also on the older news is a photo on the lower left with this video that Italians published, for the rest of the world and said, hey, take this seriously because we didn't 10 days ago. These are videos of people saying what I would tell myself 10 days ago, if I could tell myself now, to watch out. And what else do we have on the right? The same news, 4,000 dead, 793 more victims, and all unnecessary activities closed. So this is Italy just not doing a good job of, keeping it from spreading and not doing a good job of keeping people alive. And the bottom middle picture here is, what's that? Just an official meeting. You can see on a small picture on the lower right, this came out today, they're all looking at a big picture of a big screen of everybody else talking that's not in this meeting, and another big screen of the Johns Hopkins tracker is up in the background. Then what do we have? Spain. So in Spain, the old news from yesterday, they're thinking about converting hospitals or closing hospitals and actually converting a couple to, closing hotels, and they're actually thinking about converting a couple to hospitals. Zero tolerance was announced, big fines if you're out in Spain. And Spain's coronavirus cases leaped by 5,000, now only behind China and Italy, except for the United States is, in there too. Death toll passes 1,300, almost 25,000 cases worldwide. And another thing, the former coach of Real Madrid, the soccer football team, one of the most famous teams in the world, the former owner died of coronavirus. Then I've been putting Germany and France on one page because it's really hard to get news out of either one of these countries that are specific to their own country. I guess, if you look at USA Today, probably there's a lot of news about the rest of the world, even though it's a U.S. publication. But okay, so the older news is, Germany is threatening a national curfew, and also they have policemen here on motorcycles stopping people who are out walking around, saying, "Hey, what are you doing outside?" And on the lower left, this is from France. A French company says that they have millions of doses of this drug. What is this drug? It's the same thing that South Korea is using. It's an anti-malaria, anti-AIDS drug. And President Trump came out today and said something about, his favorite drug now is this anti-malaria drug. Use Kaletra. That's the drug to use. Okay, so more recent news from Welt. This is Welt and Spiegel. I've spent a lot of time in Germany, and I'm kind of fluent in German. So I look at these two news sites every day. The World, which is Welt, is a $600 billion package that matches what Spain, committed a few days ago, to save large companies and stuff like that. Just a big, huge package, a financial package. People should stay home. Companies are going to lose money. We'll make a financial package for it. And from the Spiegel, which is the Mirror, now more than 20,000 people are infected in Germany. From France, 112 deaths in a day. That's a big number of deaths for them. And the French government orders 250 million masks. Where are you going to get 250 million masks? Probably from China, because China's done with this stuff now. And because, DuPont, an American company, and 3M, an American company, most of the masks that these guys made are made in China. They opened plants in China to make masks for the United States. But China, confiscated them all. So that's why there's a shortage of masks in the United States. But, France is going to order 250 million masks, which, could help. But, hopefully they'll be able to get them. So Iran's making the news because they're up there as far as number of cases and number of deaths go. And, you get sick of reading news out of Iran because it's just crazy. The news articles on the right, or screen prints on the right, is what they ran for weeks, saying that, it's immoral to bully and kill innocents. The sanctions on Iran are affecting Iran's ability to fight the coronavirus. That was the rhetoric coming out of there for weeks and weeks. And then finally, a couple days ago, the enemy's economic pressure fails to defeat the Iranian nation. Yeah, the enemy, the United States. Ask your college students who the enemy is. It's you guys, the leadership, not the United States. So now they're back to, saying, the same thing. It's the sanctions, that's hurting us, fighting the coronavirus. And this is just crazy. if you can make nuclear reactors, you can make a mask. Make some masks. The reason you're in this trouble is because you announced to the planet that you're not going to close this, city and this religious shrine for this annual pilgrimage. You encourage people to go there. Okay, this is in the city of Qom, QOM. And it's a religious shrine, and there's a religious pilgrimage there every year. And you can see by these pictures, these people were like packed in here like sardines. They're staying in hostels where they're staying in bunk beds, and they're eating together, going to the bathroom together, taking showers together, and they're licking the shrine to show that they're not afraid of coronavirus. And what happened? These guys that were licking the shrine are in prison now, looking just worried about getting flogged in public. And Tehran has a zillion cases now because of your own stupidity. That's the reason Iran has a big issue. So then we take a look at the United States. So the United States is number 2 behind Italy now, passing Spain and Germany, 25,493. It's up a little bit from that now, but I took the screenshot earlier. So cases up from 19,352 to 25,493. Deaths up from 250 to 307. Still 307 is a small number of deaths. And it's kind of amazing that the number is so small, because one of the big epicenters is the state of Washington. And in the state of Washington, most of the issues came from this coronavirus getting into a couple of old elderly care facilities. And it's just decimated people there, killing, 40, 50 people. So we'll take a look at these epicenters. New Jersey's kind of a new epicenter, 1,327. I don't know what they were yesterday. I didn't look, but I decided to put them in as the 4th epicenter in the U.S. So Washington, California, New York, and New Jersey. So the state of Washington went from 1,524 cases to 1,793, which is a pretty good-sized jump, really big jump. But the governor came out and said that no immediate plans to expand the virus restrictions in the state. So nothing statewide, even though on the lower right you can see the mayor of Everett decides to order a stay-inside directive. And that's probably a good idea. It's a good idea for counties, surrounding the epicenter in Washington, which would be 3 counties, Snohomish and Pierce, and I forget the other one, but 3 counties south of Seattle. And on the upper right, you have a epidemiologist saying that our warehouse is empty. You're hearing a lot about a shortage of supplies, and that's again because American industry likes to make everything in China. Stop doing that. China is not a good place to make things. Get stuff made in, Thailand or Vietnam or Mexico. So, this is kind of crazy. We're hearing about a shortage of medical supplies everywhere. And I forgot to delete the ad there. Sorry. It's a hand sanitizer. J Sung. It looks exactly like Purell from the United States, from Akron, Ohio, but Chinese knockoff. And on the lower left, 2 big pieces of news that came out earlier in the week on Monday. Everybody covered this in the news and said that these tests are starting at Kaiser Permanente and with 45 volunteers in the Seattle area. Okay. But it didn't come out until, actually, I don't even know if it came out. I had to search for it. But this is actually considered a clinical trial. So this is a vaccine clinical trial going on here. So it's, and this is, there's a lot of different ways to make a vaccine. And one is with a live virus. You can take a live virus, or, viruses are neither live or dead, but if you break them up and destroy them, they can't reproduce. You just have the pieces. That's the old way kind of doing the virus. And then a newer way is taking the live virus and genetically altering the virus so it doesn't like human tissue anymore. And you would do that by growing it on chickens or something like that. And it doesn't like humans, it likes chickens. So you put it inside a human and the immune system says, hey, this doesn't belong to me, let's attack it. But it won't attack human cells. But this test here, this clinical trial is going on with a genetic marker um, vaccine. So it's just using, it's just something containing the genetic markers for coronavirus, and the immune system is going to say, hey, this doesn't belong to us, let's attack it. But it's not a living virus of any type put into humans, so there's not very much risk involved here. California, 1,247 to 1,364. It's amazing that California is under control as much as they are. So the news coming out yesterday was a 34-year-old guy died of coronavirus. And they say it doesn't affect young people, but it does sometimes. New news today, governor directing $42 million in emergency funding for the healthcare system. California is going into its first weekend of the stay-at-home order. This is a governor-mandated, it's a governor's mandate. And, California people go home and stay home. Don't go outside. So this is a weekend. We'll see how that works. This is the first weekend. And on the right, Sacramento is deploying the National Guard, to help out. This is something that China did. This is something that South Korea did. Haven't seen very many instances of this happening in the U.S. But, like the city of New York, we'll talk about that in a minute. So that was a short minute. New York went from 8,403 cases to 11,710. So New York's one of the places that's out of control. Kumo warns young people because, the previous one, a case from California where a 34-year-old died after contracting coronavirus like 2 days earlier. He died. So, testing, detection, and medical treatment. Got to improve those areas. New York weighs 4 temporary hospital sites, including Javits Center. I don't know what that is. Javits Center. I spent enough time in New York, but I don't know what that is. Probably a convention center. And that's what they should be doing. Convention centers and maybe big hotels. Turn them into hospitals. Bring in the National Guard. Also, disaster declaration gives New York access to billions. New York City Health Department moves to curtail testing as hospitals are overwhelmed. Well, you don't want to curtail testing. Just make more hospitals, put up tents. It's getting warm out, there's heated tents all over China outside of hospitals. They use it as a pre-screening area. That was an invention by China. And also South Korea adopted the same thing. Throw up some tents, pre-screening tents. You don't have to have all these people going into a hospital. And what do we have on the upper right? New York. This is talking about where the cases are. So I was wondering that, and I searched for this because I couldn't find the numbers anywhere. All the New York State cases in New York City, just about. So it says here there's 1,000 in Westchester County, just north of the city, and I found this interactive map. And if you roll your cursor around on this map, you can see I think there was like 33 cases in Erie County, only a few in Niagara. And if you scroll, as you scroll your mouse by these counties in blue, which are where there are cases, the closer you get to New York City, the more cases they have. So basically, this is an issue in the greater New York area, New York City area. And then what do we have? New Jersey. I haven't been following New Jersey, but it's up to 1,327 cases now, so it's an epicenter too. So New Jersey residents ordered to stay home amid outbreak. General news out of the United States today from NBC, I think that is. Over 80 million Americans under virtual lockdown. That includes, 40 million people in California, almost 40 million. And then we have a guy here in Forbes, coronavirus cases are growing faster in the United States than any other country in the world. Yeah, for the last 2 days, I don't know if I would write an article, based on last 2 days, that looks like this. This is kind of, dramatizing things a little bit. You wouldn't publish a study based on 2 pieces of data, right? If you had a brain. Coronavirus kills 4 members of the New Jersey family. This one family has several members that are infected, and 4 of them have died already. That's crazy, to lose that many people in one family. And on the bottom right, this is somebody just happened to take a video, or they knew this guy was coming. This is an American coming in from Aruba who was in pretty bad shape. So they flew him back home to the United States in a specialty airplane with a specialty, module that they put him in. They sedated him. He slept the whole time, But we've seen this before with Ebola, bringing Americans back with these they have airplanes and ambulances, and they're all made to take these containment, virus containment outfits. Then what do we have? We have a graph that I made because I don't see another graph of what's happening in the United States. So we went from 16 cases all the way up to 25,493. And from about 312 on, this is a upward curving. It's accelerating. We'll see what happens the next couple days, but right now it's accelerating at a pretty big rate. And another graph I made showing, some countries at Italy, South Korea, Iran, France, Spain, Germany, and the USA. So the big thing here is the orange line. This is South Korea, and they started out, bombarded just in a matter of a few days, going up to, from nothing to several thousand cases. But now they've got it under control. You see that orange line is not shooting up there. They still have isolated pockets, all attributable to this church. What South Korea needs to do, the prime minister came out today and said, that we should consider shutting down religious events and large gatherings, sporting events, because, South Korea is not under lockdown. They're doing this without a lockdown. But what they also ought to do is look at that church and say, okay, you people are in South Korea. I'm sure that church contains, 50% illegal aliens, from all other countries in the world. Deport them. Get them the heck out of your country. That's a good way to keep these pockets from popping up, is to cut the population of this church in half. You could do it overnight if you just went into that church and said, why are you in South Korea? We're not a rest home for the rest of the world. So that's what needs to be done there. Okay, that's all we have for today. Appreciate your time.